By the saints, by Our Lady, by our Lord, we prevail. This video is for veterans out there to encourage you within seeing your provider. Within a day or two of seeing them, probably about 2 days, if you did blood testing, um, look it up. Log in and look it up. Because if they get really busy, they have a process where they look at it and then they do an electronic signature, and then it goes, and then the lab will upload it. Or actually, it's medical records will do their part for it to be uploaded to Myheathyvet. Excuse me. Now, if you're going through urgent care or a VA that has a ER, then stuff is uploaded immediately, like within 12 hours. But like I said, depending on their situation and how busy the individual teams are. Now, even if you're on a team with two doctors, if they're really busy, like I said, and they don't know you, they don't know your name. So, knowing your history, when they see your name, and they just do their part, so it's uploaded, they, may miss things. Or they may know about it, but they don't put, two and two together to make four. Which in my case of going to urgent care and this is actually a positive comment, VA doesn't have a lot of those from me lately. But the urgent care doctor and the nurse, both were in there. They did a IND, which is inject and dissect. Basically, it's draining something, an abscess, a wound, animal or spider bite, stuff like that. And sometimes you have to remove necrotic tissue too. So then it becomes removal. But she tried her best, the doctor, to do the dissection. But the growth is rather complicated, and it's a little bit larger than it feels when you palpate it. So the first step is ultrasound, and I don't know where they'll go from there. Maybe MRI, and then they'll have to take a biopsy. Honestly, I'm sick of these growths, these abscesses. I'm tired of the swollen lymph nodes. I just wish that somebody would, obviously, with an 80% chance of success, DMARDs would help me. Some DMARD. Because obviously it's some kind of autoimmune. We know it's nothing like HIV. We know it's nothing like leukemia. We know it's nothing like blood cancer. We know, let's see, what else do we rule out? We know it's not, I think we ruled out lymphoma, I think. And we have psoriatic and rheumatoid arthritis in my family. I've been deployed to the Middle East for an extended period of time. Let's see, active duty, I was there for 10 months. And as a civilian, of course, this is unrelated for the VA, but as a civilian, I was there for 4 years doing contracting work in the Middle East. But so, I mean, it's obvious when you look at the other symptoms and you put two and two together, it's one of the arthritis. It could be lupus, but if you look at the other stuff that I have, it's obvious it's not. But I don't know. I guess they have their process. I don't know. And certainly don't want to give me medication. Number one, that's wrong. Number two, so I get better quick, and then our financial captivity is ended. Or we get some definitive diagnosis and find out it is related to the Middle East, so they have to pay me. And then again, our financial captivity is ended, and we will leave. But I wonder if people from the company, how many other people got sick, or how many other people that were living at Air John. Let's see, in the pod Actually, we didn't have pods. We had the long tents, which are actually buildings. People that stayed in there. It was that Central. What's it Central there, John? That was that was. Let's see, Western, Northwestern. Yeah, I think it's Northwest or Southwest. I think it's Northwest. Yeah, I think it's Northwest area of Air John. That's where we lived and worked. But I usually ate uh, southern, the southern defect at Air John. I went there a lot. I like the southern defect. I like. I don't know why. I just liked it a little bit better. Um, it's a little more comfy and cozy. It had little, areas where people could sit in groups. It's more like a diner kind of thing. I don't know. I'm a country guy, so it's more like a country restaurant you'd see with little alcoves inside the building, um, and couches and stuff. I don't know, just more comfy. So I went there probably more than the defect that's right next to my our barracks. But anyway, so I wonder how many other people are sick. They're wading through all of this packed deck stuff. And there's some people that are trying to stifle things, some people that are trying to hide stuff. Um, the current administration, I'm neither their greatest supporter or their greatest critic, but the latest um, memorandum they put out about people publishing results of studies and stuff without the permission of the VA, that's messed up. But it's not surprising. I'm seeing a history here, and any of my subscribers, if you're Republican, you got to realize the Republican Party is changing the past 10 years. So is the Democrat Party. They're changing. They're becoming more confrontational, and they're ramping up their alliances. Our democracy is becoming a confrontational democracy. And if you look at the history of the Roman Empire and the history of the Greek Empire, you'll see that the same things happened before they fell. And look at the Baltic states, same thing happened before they fell. But you'll see, anyway, it's just, some real concerns. And especially affecting us veterans. I had a conservative tell me one time, well, if every veteran, was getting compensated and getting the full medical care they need, it would bankrupt the system. And I'm like, well, that's true, but then again, this money should have been set aside a long time ago, so why are we shaming the victims by saying, oh, well, we don't have no budget? That's victim shaming. It's very indirect, but it's victim shaming. And I'm like, well, you have a point, but still. But anyway, oh, people say, oh, well, stop feeling like you're entitled. People who've done what veterans have done, especially those who are under fire and lost friends, lost limbs, or have permanent injury, they deserve this. They're entitled to it. It's no matter of entitlement. It's a demand, and it's in the it's in the United States Code. So enough of people saying, "Oh, veterans, they think they're so entitled." They are. Have you ever read U.S. Code? But anyway, with that being said, so the read your results because we don't know much about this mass, but we know I've had so many abscesses the past. Shoot, the first abscess I ever had, which we thought was a spider, but we could never find the spider. But the physician actually, this was overseas. It was a government hospital overseas. I was a contractor, and shoot, that was like what 6, no, maybe 9, no, maybe a year after I came back from Arifjan. No, a year and a half, maybe somewhere around there. Year and a half, 2 years after I was in Arifjan for 10 months that this happened. Somewhere, around there, give or take. And and he actually had to remove the whole, about, I would say, it's a good chunk, probably the size of a teaspoon, a heaping teaspoon. He had to remove it from my leg. That was the first time I had an abscess, and still I thought it was a spider bite, but they couldn't find evidence of a hole, and they couldn't. I never found the spider, so we still don't know. He said, well, I guess a spider, he could have came in from an angle or something. He said, I can't say because it broke open. He said, but it's hard, but there is necrotic tissue. He's like, I can't say for sure. It could just be an abscess that's become necrotic and you never noticed it because it was in the back of my knee. So, but I've been dealing with these for like 15, 20 years. These abscesses and enlarged lymph nodes. Now I know what they are. In 2014, I had an enlarged lymph node under my right arm. And although it eventually faded, it's still larger there under the arm than it is on the left side. I mean, it was under the right side, my correction. So it's still slightly larger underarm underneath than the left side underarm. But I have, like, right now, 3 of these things. Oh, wait, no, 4. 3 are in my medical records. 4 hasn't been assessed yet. So this abscess is probably connected to them. But anyway, so she didn't want to fully excise it. Or she didn't want to make a full incision to excise it because it's larger and deeper than, she anticipated. She's like, this needs an ultrasound first. But the good thing that she did what she did, I got good care there that day last week. I have nothing negative to say. I mean, I was up in a chair in stirrups, and because they had to get to areas around my legs and stuff that you just I can't do it laying down. So it was kind of funny. But then again, a father should be sensitized to what women have to go through when you have a daughter. I mean, even if you love your wife, know a little bit about what they have to go through once a year. Recommended once a year. I mean, there's nothing wrong with that. I mean, it's kind of a joke. It didn't bother me. It's uncomfortable, and you can't be involved because of the position you're in. So it's just like being put out. This is what women go through. They're not able to be involved in this because the position they're in. So the physician and their assistant, can do their assessments, do their yearly check. So I mean, it's really it's how could I say? It's almost exclusive because the position you're in, you're not involved, and you may not see anything. So this sensitizes us to the experiences of our mothers, our wives, and our daughters. And an educated patient is the best patient. So it didn't bother me at all. They had to get to the leg and the area around the leg and everything. And so she couldn't fully open it. It's larger than we anticipated. I thought like 2 marbles. She's like, no, I think it's a little bit bigger than that. And she's like, it kind of seems to go deeper in. She said, so I don't want to make a big incision and have something pop out or hit something. She said, because there's multiple things that this could be besides an abscess. But she said, I think it's an abscess. But so we're gonna wait. But it's a good thing that she did she did very aggressive scientific-based medicine, and I'm very happy. They're very humble, and they made jokes. So I made jokes too. It's a very good experience, and I was pleased with the treatment they gave. Um, she opened it enough to drain. I mean, it's disappointing it couldn't be fully excised, but like she said, the size is larger, and it's very exturated, which means it's like pushing out, but yet there's more mass inside. It's just it's dangerous without being in an OR to treat this aggressively. I mean, as it is, looks like I lost a bit of blood. Um, maybe, maybe about an eighth of a liter, somewhere, or not an eighth of a pint, I mean. You know, enough do you notice, but not enough to hurt you or anything, but it's enough to notice. You know, surprising for just an abscess to lose that much. So, and there are veins and arteries in the area. But I'm glad that she was aggressive with blood testing and urine testing because, um, you know, this is why I just wanted to put this video out, people to really pay attention to the tests because my urine glucose came back extremely high. We're talking 1,000. That's high, even for urine glucose. And then my glucose sugar came back also high, very high, in the diabetic territory, which, you know, it should be VA policy on two different occasions. If you have glucose testing, and whether it's blood or urine, generally they prefer blood, fasting blood of 2, but it's not required in the VA regs. It's just 2 blood tests of high glucose. Then your doctor can diagnose you as diabetic or pre-diabetic. But if you're doing 2 tests and your testing score is high, um, I think it's, you know, it's safe. Of course, I'm not a provider, but the safe doctor, the cautious doctor, would say somebody's diabetic. If you're going to say somebody's pre-diabetic and they have two glucose tests that are high, let's say one is in the diabetes category and one is in pre-diabetic, but less than 20 or 30 points from diabetic, you should go with diabetic to be safe, you know, um, or test again. But if you're, you know, going to throw in a urine test too that's high, along with 1 or 2 glucose blood tests that are high, you've already satisfied the criteria for diabetes. And yeah, I mean, it's disappointing. You know, it stops somebody from certain kinds of federal service. Some companies in the defense world will not pick you up. But then again, from what I've seen, I would not do the same kind of thing now. I would not work for the same kind of companies. And, you know, if I was working with the military, which I can't because of my health, not just this, but I'd be a lot more cautious in what I would do because of what's happened to my family. It's made me very resistant to support the agencies and the companies that I used to support before. Um, but anyway, so pay attention to those tests, you know, and your urine, is it clear? Is it dark? Does it have a putrid smell? You know, I found out that my urine has a, well, I don't care, I'm going to put it out there. My urine, the past few days has had a putrid smell because I'm throwing a few ketones. You know, I've started to go into ketoacidosis, very small, so we can stop it by removing sugar from my diet, which we've done. This is day 2. Um, Actually, I haven't removed all the sugar. I need to be more aggressive. There's one thing that still has sugar in it that I'm drinking, so that has to be eliminated too. So I went to totally to stevia or honey, and actually we're out of honey. I went to stevia. So I mean, it explains a lot, and I'm glad that she did the blood testing. You know, this is, you know, especially being as somebody broke in and destroyed some of my medical testing equipment. I don't have a glucose meter anymore. Somebody ruined it somehow. They did something to the sensor. I'd rather have a continuous glucose monitor anyway. I think that's the way to go. Some people who are slipping into diabetes, maybe if they had a continuous glucose monitor, they could be pulled back. You know, because if you're aggressively treating, aggressively, pampering that pancreas and that liver. You can be moved back from type 2. It's a challenge, and it's not always successful, but it can be done. Especially with, if you have a doctor, as I mentioned in other videos, that agrees to small insulin therapy. Even when you're sitting on the fence, insulin therapy to give that pancreas a chance to heal. What's that? The islet of, darn, I forgot that cell mass. The islet. Anyway, it's part of your pancreas that specifically it's a gland that produces insulin. If it's babied and its work is lessened and its the stress is reduced, there's instances of ongoing research where it heals and somebody's pulled back from type 2 diabetes, which people will tell you, oh, it's not possible. Once you go there, you're there. No, not true. They're finding that certain approaches, which are considered alternative therapies, people are being pulled back from type 2 diabetes because the medical model we're using to treat diabetes type 1 and type 2 is wrong. It's based on a faulty model that the body's faulty, and once a certain switch is flicked, you can't change back. That's incorrect. At least with type 2, it's incorrect. But anyway, this is medical geek stuff. But so vets, check those tests, and I did read a article about a Saginaw County veteran, actually a veteran from city of Saginaw. I showed a picture of him and his wife. I think I've seen him before around town or on the bus. As an African American gentleman, I swear he looks familiar. But by his knowing this education stuff from pamphlets and stuff, I think somebody gave him a pamphlet or something, and he called in for a confirmation, and somebody confirmed that, like, yeah, you're going into ketoacidosis, like severely. Go to an ER now. It has saved his life because he remembered from the pamphlet about the urine stuff. The smell, the color, the feeling, how you feel during that time. The heartbeat, breathing issues, all of this stuff, and it saved his life. And then he called in to whoever he talked to, somebody. Hopefully it wasn't an MSA, so they get the credit. Hopefully it was a provider who was aggressive in their treatment, maybe a triage nurse. Um, but anyway, so his life was saved because of that education, the diabetes education. It's very important, and paying attention to those symptoms, paying attention to the blood chemistry testing, that may save your life.